Hi, this is Shane Hostensky. Today I'm going to be going over Module 1 assignment, which talks all about the lungs and adult health too. And I'm going to start out with inhalation and the effect on lungs. So healthy lungs are made of spongy, pinkish gray tissue, and I'm going to be using this as a demonstration. So imagine these are our lungs, these two balloons, and they're made out of spongy, pinkish gray tissue and are elastic, so they are able to expand when it inhales and exhales. So I'll give you guys an example. Inhale, exhale. Inhale, exhale. The lungs function by making oxygen available to the body and removing gases such as carbon dioxide from the body. This process of inhalation and exhalation occurs anywhere on average from 12 to 20 times per minute, or in other words, 12 to 20 respirations per minute. Now, to begin with the inhalation process, the respiratory system first acts as a defense, preventing harmful substances from entering the human body. Small hairs in the nose act as an air cleaning system, filtering out large particles. Mucus is also created in the trachea and bronchial tubes to keep things moist in air passages, and also aid in defending against bacteria and other substances. So imagine this is our nose and mouth, and then mucus is created in these airways to help, that's our defense against harmful things in the air. Now, when a human being inhales air, the diaphragm moves downward and towards the abdomen. So imagine we're exhaled and we inhale. So the diaphragm's going to move down. With the rib muscles pulling the ribs upward and outward. This makes the chest cavity bigger. So when we're inhaling, everything's expanding. Now, to take a closer look at the actual process, the human inhales air through their nose or mouth. This air travels down the pharynx, which is the back of the throat, then passes through the larynx, which is the voice box, and into one's trachea, or better known as windpipe. So when that air is inhaled, if you guys can see the whole thing, through the nose or mouth, it's going to travel down to the pharynx, which is the back of the throat, and then the larynx, which is the voice box, into one's trachea. The trachea is divided into two air passages known as the bronchial tubes, which go into the right and left lung. So that's going to be these two, separating into the right and left lung. One of these bronchial tubes leads to the right lung, whilst the other bronchial tube leads to the left lung. These bronchial tubes divide into even smaller tubes known as bronchi, and then into bronchioles. These bronchioles end in tiny air sacs known as alveoli. This is where the oxygen in the air is transferred from the inhaled air to the blood. Now, once this oxygen is absorbed into the blood leaves the lungs and circulates to the heart. The heart then pumps this oxygenated blood through one's body, providing oxygen to cells of tissues and organs. So now moving on, we're going to talk a little bit about the exhalation process. So the exhalation process, imagine we're inhaled, like so, if you guys can see, and then we're going to exhale. That's what we're going to talk about. When exhaling, the diaphragm moves upward and the chest wall muscles relax, causing the chest cavity to become smaller and air push out. Taking a closer look after the process of inhalation, what needs to come out of the body is not only air, but the carbon dioxide that is within the human body, as that is toxic to our bodies. During exhalation, the carbon dioxide in our cells moves out of the cells into our capillaries, where most of it dissolves in the plasma of our blood. Blood that still contains this carbon dioxide, though, then returns to the heart through our veins. The heart then pumps blood into our lungs, where the carbon dioxide passes into the alveoli to be exhaled. Moving on, I'm going to talk a little bit about our lung capacity. The average lung capacity is around 6 liters, where the lungs develop and mature by the age of around 25. By age 35, the lung capacity often have tendency to decline. Now, certain factors can change a person's lung capacity. The diaphragm becomes weaker as a person ages, lung tissue can lose elasticity, and also one's rib cage bones can alter and become smaller, leaving less room for expansion. Now, lung capacity can also differ from person to person depending on the size of that person. So imagine a taller person who has a taller, rib cage, or a longer rib cage or wider rib cage. That can affect their lung capacity. The location a person lives can also play a factor, with those living in higher altitude having larger lung capacities to compensate for that atmospheric pressure. Lifestyle factors affect lung capacity as well. Obese people and smokers often have lower lung capacities. Now moving on, I'm going to talk a little bit about how asthma affects the lungs. Asthma affects the airways of one's lungs. When one has asthma, their airways are often hypersensitive and always red and inflamed, becoming narrower, making it more difficult for air to pass through. So imagine these airways being all swollen and inflamed. That's definitely going to affect the way that air is able to travel down, especially when one's having an asthma attack. I'll get to that. Extra mucus is also created, leading to symptoms of difficulty breathing, coughing, and whistling noise when exhaling. Now, having asthma and hypersensitive airways, when things trigger these sensitive airways, such as stress, a cold, changes in weather, changes in environment, such as dust, especially in Arizona, very dusty, or chemicals, this can cause an asthma flare-up, or better known as an asthma attack. During this event, the airways swell even more, so these airways are going to just swell and close up, making it difficult for that person to breathe. And the muscles that wrap around these airways may also tighten. So everything's just going to tighten up and make it more difficult for that person to breathe, narrowing the airway even more, making it more difficult for air to pass through the airway. This all affects the lungs by decreasing the amount of oxygen that is able to enter the lungs and into the bloodstream, affecting the respiratory system overall. Moving on to the next question that I'm going to answer is the treatment for asthma exacerbation, or in other words, an asthma attack. At the first sign of an asthma attack, the first step is to take 2 to 6 puffs of a quick-acting inhaler containing airway-expanding medication such as albuterol. Those who have trouble using an inhaler may use a nebulizer. If these quick-acting treatment methods prove not effective, one should render emergency help right away. Once in the emergency room, oftentimes a provider will continue to try to use short-acting beta agonists such as albuterol in inhaler or nebulizer form. Oral corticosteroids may also be used in pill form, which reduce lung inflammation. Ipratropium can also be used as a bronchodilator if the albuterol is not fully effective. And last resort, intubation, mechanical ventilation, and oxygen if the asthma attack is life-threatening and not responding to the previous methods of treatment. Now, teachings about asthma to patients is very important. The most important teachings to give a patient with asthma is to ensure they follow their treatment plan and avoid triggers that lead to their asthma attacks. One with asthma, most importantly, wants to avoid having an asthma attack, in order to do so, one must avoid the things in which trigger that asthma attack, such as, for example, cigarette smoke, pollen, stress, overinduced exercise, etc. One should become familiar with their asthma and the best way to live with it and the triggers. A nurse must also ensure a patient knows what to do if they feel an asthma attack coming on. The first step, obviously, is to use a rescue inhaler or nebulizer treatment, and if that proves ineffective, get help immediately. And lastly, I'm going to talk a little bit about asthma resources. So, as far as asthma resources and help, depending on the state you are in, there are many asthma resources that can be provided. For example, in Arizona, one can go to azasthma.org and look at their website to find all kinds of information and resources regarding asthma. And that's all. Thank you very much.